Hello everyone, in this video demonstration we will be doing the physical examination of the upper and the lower limb. Before starting the examination, ensure that you have washed your hands or used a hand sanitizer. Then you will need to introduce yourself and ask for the patient's consent before continuing with the examination. In inspection of the upper limbs, the arms should be at its normal resting position. Look for any scars, deformity or any muscle wasting, and then proceed to look for any fasciculations. And then ask the patient to stretch out both arms and then look for any abnormal movements. Now we will check for the tone by doing passive movements of the joints. First, rotate the shoulder joints and then do extension and flexion of the elbow joints and then extension and flexion of the wrist joint. Now we will check for the muscle power of the upper limbs. First, we check for the shoulder abduction to test for C5. And then we test for the elbow extension and flexion and also the wrist extension and flexion for C6 and C7. And then we check for the fingers abduction and adduction for C8 and T1. Now we will test for the reflexes of the upper limbs. There are 3 reflexes to be tested. The first one is the biceps reflex, which is testing for C5 and C6. The second one is triceps reflex, testing for the C7. And then the last one is the supinator reflex, testing for the C6. Now we will proceed to test for the coordination of the upper limb. The first test for this is the rapid alternating movement. Tell the patient to tap the palm of a hand with the opposite hand alternatively, and then ask her to increase the speed. Observe for any irregular or slow movements. The second test for coordination is the finger to nose test. Using her index finger, ask the patient to touch your finger, ensuring that the patient's arm is outstretched in front of her. Next, tell her to tap the tip of her nose. Repeat this action for a few more times and then observe for any abnormality in the movements. Next, we will do the test for proprioception. First, hold the sides of the distal phalanx of the thumb. Then, by moving the interphalangeal joint, demonstrate to the patient that extension is up and then flexion is down. With the patient's eyes closed, move the joint and then ask her to tell the position of the joint. We will proceed with the sensation according to the dermatomes. The first one is the tip of the shoulder, checking for C4, and then the lateral upper arm, checking for C5, then the lateral aspect of the forearm, checking for C6, and then the tip of the middle finger, checking for C7, and then the tip of the little finger, checking for C8, and then the medial aspect of the forearm, checking for the T1.
I would like to complete my examination with lower limb examination, autonomic examination, and vascular examination.
Hi, very morning. I'm Kevin from Unimas. I would like to examine your leg today. Okay,
Firstly, we are going to inspect the patient's lower limb. Stand at the end of the bed and look for any scar, deformity, and muscle wasting. You can also ask the patient to stand up to look closer into the muscle wasting anteriorly, laterally, and posteriorly. Next, we will be checking for the tone. With the patient lying down, roll each leg to assess for the tone of the muscles responsible for the hip rotation. Then proceed by lifting each knee briskly and observe the leg movement. Now we will be testing the muscle power. Ask the patient to move his limb first before applying pressure to oppose the muscle power. Begin by doing the hip flexion for L1 and L2, hip extension for L5 and S1, hip abduction for L4 and L5, and hip adduction for L2 and L3. As for the knee, do knee flexion to test for S1 and knee extension to test for L3 and L4. As for the ankle, do ankle dorsiflexion to test for the L4 and plantar flexion to test for S1 and S2. Now, we will test for the reflexes. We'll begin by doing the knee jerk to test for the L3 and L4. Then, we'll do the ankle jerk to test for L5 and S1. And then we'll do the plantar reflex to test for the S1. Now we will proceed for the proprioception. First, demonstrate to the patient the upwards and downwards movement of the big toe. Then ask him to close his eyes and to tell if he felt the big toe going upwards or downwards. We will now be testing for the sensation according to the dermatomes. For L1, test at the groin area. L2, at the medial aspect of the thigh. L3, medial aspect of the knee. L4, medial aspect of the leg. L5, the dorsal aspect of foot and also the big toe. S1, the lateral aspect of the foot, and then S2 at the popliteal fossa.
I would like to complete my examination with autonomic nervous system examination, vascular system examination, upper limb neurological examination, and perectal examination.